All right. Hi, I'm Amanda.
Hi, Amanda. I'm Colin.
Hi, Colin. So I'm an OTA.
Mm-hmm.
I'm from the occupational therapy department. Have you had occupational therapy before?
I've heard of it. My aunt recently just got a surgery, and I get why she's used OT, but why do I need it? I don't understand.
Well, so I've looked over your medical history, and you've had a referral to OT because of your past history of osteoarthritis, you had prostate cancer, back pain, chest pains, palpitations, things like that.
Mm-hmm.
And I know that you came in here for shortness of breath,
Yeah.
as well as chest pain. So my role is to teach you how you can do things every day that maybe make it easier for you.
Okay.
So I can teach you a myriad of techniques. So it's less rehabilitation and more let's teach you a new way to do the things every day.
Okay.
Does that make sense?
That
to you?
does.
Okay, cool.
Sounds good.
So what is, when thinking about your everyday life, what is one thing that you really don't look forward to, that really stresses you out, causes shortness of breath, like really is hard on you?
Getting dressed in the morning.
Dressed?
It takes a lot out of me, and that's when I experience shortness of breath and fatigue a lot. But yeah, that's difficult for me.
Yeah. And how are you feeling right now? Like, do you have any shortness of breath?
I have not experienced any of that today yet. Okay. But I'm actually feeling pretty good.
Awesome. Well, that's good. If you do develop shortness of breath, let me know, or if I notice it, we'll just stop and kind of regroup before we keep going.
Okay,
so,
sounds good.
So what I have for you today is, this is a handout of, it's called energy conservation.
Okay.
So the goal is to be able to do things that you do every day, but conserve energy while doing it. So like I'm going to teach you techniques or use adaptive equipment to help you get dressed or even shower, things like that.
Okay.
So today, because dressing is kind of difficult for you, and that's the one that you want to work on.
I would like to, yeah.
We're going to work on that. So that's right down here.
Okay.
And then, so the first step on there is gather all of your materials. This is going to be really helpful. Instead of going back and forth, grabbing your shirt, grabbing your pants, grabbing your socks, you want to gather it all together and make sure it's all within reach.
Okay. Yeah.
That way you minimize movement. And then next, making sure you're sitting down, which you already are, so that's great.
Okay.
At home, when you get out, or anything like that, if you could put a chair in your bedroom to make sure you have a place to sit, that'll be helpful too. And then you want to minimize bending as much as you can, so don't overstrain yourself. And we have some techniques we can teach you for that.
Okay.
So first off, the first technique for that is bringing your leg up.
Okay.
And then you would take your pants here and kind of shimmy it off one leg, and then you bring this other leg, drop it down and pull it up.
Okay.
So do you want to go ahead and try that out? Can you do that?
It's kind of difficult getting my leg up due to my weight.
Yeah, I understand that. So what we're going to do instead, let's try this. This is called a reacher.
Okay.
And what you can do is you can grab the bottom of the pants. We can test it out for you. I'll show you. So grab the pants. This will also help minimize bending.
Okay.
And with the reacher, then you can pull it up your leg. And then once you get to about here, pull it the rest of the way up.
Okay.
And then you can drop it down and do the other leg.
Okay.
Do you want to give it a shot?
Sure, I'll try. So just kind of.
Yep.
Oh, nice.
There you go. So then you don't have to bend or anything. Does that feel better?
Good.
Easier?
That was a lot easier than trying to stand up and balance.
Yeah, right. It's definitely difficult a lot of times. You know, people trying to stand up and do those sort of things is also a fall risk. So by sitting down and using techniques like this, it can really help you out. And then just keep in mind, make sure you. I know you're wearing sweatpants and just a loose t-shirt today, but even on other occasions, try to wear that as much as possible. It's going to be easier to get dressed. If there are times that you do want to dress up or wear anything else, try to restrain from restrictive things like belts and stuff like that.
Yeah.
I know that the doctors recommended compression socks for you.
Yes, they did.
Yeah. So
those are difficult.
They are difficult, right?
Yeah.
So I do have they have an adaptive equipment. And it can help you pull the sock onto your foot, and you can drop it down, so again, minimizing bending. So maybe next session we can kind of work on that.
That would be great.
I can show you how that works and kind of keep going through this list, and eventually we can get to showering and stuff like that. So
that would be great. Yeah.
So how do you feel like you could do this at home?
I think so. I think these techniques will actually help me a lot.
Yeah. You don't feel short of breath at all?
No, I actually felt pretty good through that.
Okay, good. And then other than that, do you have any questions for me?
I do not.
No?
I don't think so.
Do you have anything that you specifically want to work on next session? Because I know we had just talked about doing the socks. Is there anything that you want?
I would say showering can be very exhausting for me over time. So
maybe showering.
Yeah, I saw it was on the list of the energy conservation techniques. That showering was one of them. So that'd be great if we can talk about
that first. Yeah. Okay, so let's do showering next week. Next week that I see you, or the next time. I'm not sure how often they want me to come in.
Okay.
I'm going to talk to the OTR about that.
Okay.
But we'll do showering first, and then we can kind of maybe incorporate a little bit of dressing each time.
Okay.
So
that sounds great. Thank you.
Awesome. Well, it was good to meet you.
It was nice meeting you too.
Yeah. All right. Well, we'll see you soon.
Thanks. I think that actually went. Is it off?